folks. Okay, so just to quickly reiterate, Richard Mollett here with Long-Term Care Community Coalition, and today's program we just started. This is our first slide, first substantive slide. We're looking at the overall star ratings for nursing homes in New York State versus the Hudson Valley. And so in the Hudson Valley, we have here the different, and I've tried to make it bigger so everyone could see, the different counties. So we have Columbia, Dutchess, Greene, Orange, Putnam, Rockland, Sullivan, Ulster, and Westchester. Those are the counties that we're covering in this project that we're doing, through which we're doing these programs. So this gives you the overall rating. Again, the blue is the lowest. So you can see in Columbia County, all 4 nursing homes are 1 star. So that's pretty troubling, obviously. Here in Dutchess County, 7 of the nursing homes, there's 7, 8, 9, 10, 11, 12 nursing homes, 7 of them are 1-star facilities. And this should really be a red flag, of course, for those of us who are working to ensure that residents are safe and have good access to care, access to good care, excuse me, but also to raise these issues and with our policymakers, with our state and federal legislators, excuse me, when you call their offices, and we encourage you to do so, to raise concerns about these kind of issues. Every nursing home is paid and promises and is legally obligated to provide care that is meets or exceeds minimum standards. And when you have a 1, 2, even 3-star facility, that indicates that there is a high likelihood that there have been serious citations around care. So again, this PowerPoint presentation will be available on our website within the next couple of days. But as I mentioned at the start, this is really a 20,000-foot view. We're looking from way up, and we're going to show, I want to give you an idea of what's going on, but then we're going to show practical information about what you can look at to find your facility and how your specific facility or those in your community are functioning on some of these parameters. So we look first at overall rating. The next slide looks at staffing star rating. So I wanted to look at, staffing is by far the most important indicator of a facility's quality, of its safety, of its ability to treat residents with dignity. So here we have New York State, again, the same color coding, blue being 1 star, orange being 2 star, red being 3 star, the light blue, being 4 star, and the green being 5 star. And you could see the rate of, we have 200 or 600 or so facilities in New York. 200 of them are either null or 1 star. Null, excuse me. I just didn't notice before that was part of there. But null is 4 nursing homes, 200. And I apologize. I just noticed that little 4 over there. So null means essentially that either the facility did not provide enough data, or the data, there was something wrong with the data that it provided to the federal government, or its numbers are being suppressed because it is a special focus facility, a facility that has significant problems. So pardon me for just clarifying that, but here we don't have any nulls in the Hudson Valley, and you could see the makeup again by county. So the Columbia County, 3 of the 4 nursing homes here are essentially a 1 star in staffing, the lowest possible rating. You see here in Westchester, 12 are 1 star, another 12 are 2 star. That's more than half of the nursing homes in Westchester County have very, very low ratings in terms of the number of staff. And again, the number of staff, having sufficient numbers of appropriately trained staff is the most important indicator of a facility's quality and safety. As I mentioned at the start of today's program, last time we spoke a bit about ownership and the importance of ownership. So I wanted to touch on that here so you could see what is going on in New York and what is going on in our counties in the Hudson Valley. So the blue-green is the for-profit. The darker green is government-owned, and the yellow signifies not-for-profits. So you can see most of the facilities in New York now are run for-profit by for-profit companies. And you can see the breakdown here. Look here at Westchester, 30 of the 42 facilities are run for-profit. All of the nursing homes in Columbia are for-profit. 10 of the 12 nursing homes in Dutchess are for-profit, etc. All the nursing homes in Green and Putnam HF2 are for-profit, etc. Right now, our leaders in Albany are debating a budget and debating giving nursing homes more money. And nursing homes are claiming that they're losing money, that they have raised within margins. This is frankly, the same story that has been going on, the same claims that have been made since well before my time, since really, the 80s and I think even the 70s, when Medicare and Medicaid first started paying for nursing home care. But the fact is, as we can see here, most nursing homes in our communities are owned by for-profit companies. These are not companies that are running at a loss. These are people, if you look at the Department of Health's website, there's something called the Public Health and Health Planning Council. They are the ones who are charged with overseeing who gets to buy nursing homes. Nursing homes are bought and sold all the time in New York, and quite often not-for-profits, government-owned facilities are sold to for-profits. They are not doing that because nursing homes are losing money. It begs credulity to make that argument, frankly, when we see that more and more of these companies are coming in and buying up facilities. What I next wanted to show, and again, just as a reminder, this is a very high level look at things, and we're going to dig down deeper in a little bit. I wanted to provide information on nursing homes that are part of a chain. So they're just not, in the past, I should say, we used to have a lot of what are called mom and pop nursing homes. They were family run. They were people that were connected to the communities in which they owned a nursing home. More and more, I would say, especially over the past 20 or so years, we've seen a corporatization of nursing home care, where companies come in and they're gobbling up nursing homes. Again, why? Because nursing homes are very lucrative profit centers, even though the industry says that they aren't. So here we can see the dark purple is, or the purple is the ones that are not part of a chain. The federal government calls a chain an affiliated entity, means there are affiliations with other facilities, and 287 of our nursing homes in New York are part of a chain. So, about 45% or so of our nursing homes in New York now are part of a chain. They're not singly owned. Here we have, again, looking in the Hudson Valley, we see Columbia County has a lot of chain ownership. Dutchess is evenly split. So is Westchester, roughly. But we see more and more Greene counties, all chain ownership. Putnam is split. So this provides, valuable information, again, from a very high level. We're not looking specifically at this point to say what's going on in my community, what's going on in my state, is that we have these chains that are coming in and they're buying up facilities. I should mention, just very quickly, that the federal government, the Centers for Medicare and Medicaid Services, just started reporting this chain information about, I think it was about a year and a half ago now. And so it's not perfect. It's self-reported by the nursing home companies themselves. So there is some missing information. There are some chain facilities that are not reported as being chain facilities, but this gives you some clue and some insights. And that was something that we advocated for several years ago with CMS, which we were pleased to see that they provided that information, but also, of course, we'll be advocating for further refinement of that so that it could provide even better information to the public. A couple of slides, again, just at a very high level, and then we'll dig down a little bit deeper, is these are nursing homes that have not been inspected in 2 or more years. For those of you who are not familiar with the requirements, the nursing homes are required to be inspected. Excuse me, let me rephrase that. The state Department of Health, and this is true for every state in the country, the states are required to inspect nursing homes on average of every 12 months. And for a specific nursing home, there is a window of between 9 and 15 months. So again, to repeat that, nursing homes under the state contract with the federal government, the state gets paid by the federal government to oversee nursing home care, to respond to complaints, et cetera. As part of that contract, they are required to inspect their facilities in their state on an average of every 12 months, and every facility is required to be inspected within a 9 to 15-month period. And that period allows for the state agency, our Department of Health, in this case, in our case, excuse me, to go to look into facilities, perhaps more often if they know that there's indications that there are problems, and for facilities that seem to be doing better, they don't have to see them every 12 months. They could see them, 13, 14, 15 months. The problem is, and this is not, frankly, entirely the Department of Health's fault, is that the federal government has not increased funding at all, zero, no additional funds for oversight in over 10 years. So all the states have really been caught in a bind in terms of how do you hire people, how do you keep salaries, reasonable and competitive if you're not getting more money to do that. So, there are issues here on both the state and on the federal level, but it's important for us to know, what is going on. So here we can see that in New York State, 143 out of approximately 600 facilities have not been inspected in more than 2 years. What does that mean to the residents? What does that mean, for what is going on in those facilities? And then we showed it here. Again, the orange is not inspected in 2 years or more. The blue has been inspected. So in Columbia, 1 out of the 4 facilities has not been inspected in more than 2 years. Dutchess County, the majority of facilities, 7 out of 12 have not been inspected in more than 2 years. So you can see the different numbers here, and hopefully this could be useful for information for people on the county level, our state and our state representatives and our federal representatives. When you speak to members of Congress, and we do send invitations out to members of Congress, to legislative aides, and to members of New York State Senate and the New York State Assembly for these meetings, because this, part of the point of doing these kind of data briefings is to bring the entire community, all stakeholders in to understand what is actually going on. What do the actual data show about what's going on in our nursing homes, not just what the nursing home industry lobbyists are telling them in Albany or in Washington, D.C., but what do we can see is actually going on. What we see is that a lot of facilities have not been inspected in more than 2 years, and that's really alarming. I really worry about what is going on for the residents in those facilities. I have one more slide here. For some reason, it's not going down. Let's try that again. Okay. Last slide, again, at the 20,000-foot level or so, is looking at nursing homes with resident or family councils. I thought this would be of interest, of course, to residents and families and long-term care ombudsman in particular, but also others, our state offices, et cetera, legislative offices, et cetera, to know what is going on in our communities. Resident family councils can be really powerful voices for resident rights and quality of care and dignity in the facility. So what we have here is the brown shows, if you can see my cursor, I'm looking at New York. The brown shows that they have both a resident and family council. The yellow, I know it's very hard to see, I'll try to make it better, gold, I guess, shows just a family council. The gray shows that they have none, and then the red shows that they have, which is a wideband, that they have a resident council. So you can see about 157 nursing homes in New York have both. Very few have just a family council. 23 nursing homes have none. 419 have just a resident council. And then, excuse me, I'm going to go look here, Columbia County. You can see Columbia again looking, they just have the 4 facilities there, just have a resident council. I should preface this all by saying this again is what is reported by the facility. So things could have changed since then. It's the most recent data that we have on this that has been reported to the federal government, as nursing homes are required to report all of the information about what's going on with residents, et cetera, in their facility, their staffing, et cetera. But here we can see, we're talking about resident family councils, and you could see in the counties where there are or where there are not family and resident councils. And we see that there's, a fair amount of facilities with resident councils, but less so with family councils, and thankfully, less so that don't have either a resident or family council. As I mentioned, this is where we're going to go to next. Okay, this is interesting information just as a high-level view of what is going on in our communities. Where's the information that we can use, ourselves when we are, when we're talking about these issues, when we're working on these issues for our residents and the residents in our communities. Before we move on, I just wanted to actually show a couple of slides. So the previous slides all looked at per facility. What I thought it would be interesting to show you is also the number of beds by overall rating and staffing rating. So, facilities are one thing, but we're not concerned about what's going on with the facility. My concern, and I think our concern, is what is actually going on for the residents in these communities. So this essentially provides the same type of data. This is really from the, same as I showed in the first slide, overall rating, but it's by bed count. So you can see the number of residents and where they are in facilities by rating in each of our counties. So Columbia County, again, looking at the ratings here, we have 604 residents. They're all in facilities that have 1 star. Again, that kind of matches what goes on, but it's another way of looking at it that I thought was really important. It's always bothered me that we talk about nursing homes. Yes, of course, nursing homes are important. We want to hold nursing homes accountable for providing good care, good quality of life, and dignity. But when what are we really concerned about? We're concerned about the residents. We're concerned about residents having access, or individuals in our communities having access to high quality care. So here you can see, I just thought that was interesting to show. And then one other, again, kind of 20,000 foot or so view is of the staffing ratings. And you could see, again, blue is the lowest, 1 star, orange is 2 star, red is 3 star, light blue is 4 star, and green is 5 star. And you can see there's unfortunately not a lot of green here, not a lot of people living in 5 star facilities, and not even a lot of people living in 4 star facilities. What we're seeing is a lot of people living in 1 star facilities, 2 star facilities, and then some in 3 star facilities. So that's concerning. And these are important issues, again, for us, and hopefully for us to raise with our legislators. Okay, so I want to talk about how do you find this information about your nursing home and about nursing homes in your community? So CMS, the federal agency, Centers for Medicare and Medicaid Services, has a provider data set. And we, it's very complex. It can be very difficult to use and very cumbersome. There's hundreds of thousands of lines of data. So what we do about twice a year is we do a report of the provider data file. I'll do a quick, just show you quickly what that looks like. So here you can see, and this is just a snapshot, and these data are available nursinghomeforum1.org/data/ratings-info. And again, this will be posted to our website. You don't need to take notes or anything else. But this provides the provider name. The second column shows the city or town where the providers are. The third column is the county. And then we get to some of the information we've been talking about so far today. So you can see whether, I lost my cursor, there we go, whether the ownership type. You can see their number of certified beds as well as their number of residents. Now keep in mind, There's a bit of delay here, so the resident census, as we call the average number of residents, will likely change from day to day, or certainly from month to month somewhat. So that may not be, that information is not current, but in terms of the average number of residents per day, but it gives you some idea of the occupancy levels of these facilities. And then we have, as I mentioned before, chain ownership, what CMS calls affiliated entity name. And so you can see here, Arch Care, Sapphire Care, Personal Health Care, Infinite Care. These are the Grand Healthcare. These are some of these names I know are familiar, especially to the ombudsman and some of the advocacy groups with whom we work in the area. So you can see who owns your facility and who owns the facilities in your area. And then we have whether or not they're a special focus facility, nursing home, or a candidate, meaning that they're amongst, frankly, the worst of the worst facilities as identified by CMS. And then whether they have an abuse icon, whether they're identified as a problem facility. In our database, we do a separate reporting of problem facilities in our reporting. And those problem facilities, excuse me, I'm losing my cursor, include one-star facilities, special focus facilities, and SFF candidates. And then here you can see sorry, my cursor keeps on getting messed up. Most recent healthcare inspection more than 2 years. So you can see that information exactly for your nursing homes, or if you're looking at a certain community, et cetera, the nursing homes in your community, resident family council, overall rating, et cetera. Now, so this information, this data can be downloaded from our website, and then you could select, if you can see my cursor here, you can select what county or counties you want to look at. If you're interested in exploring what's going on in the facilities in your area, if you're an ombudsman in your area, if you're looking for a nursing home, if in your community, if you are a state representative, a state senator, or a state assembly person, or a congressperson, what is going on in these areas, and you could select them and then see what is going on. And then I'll just quickly go back up to show you that these are what's included in the data. So we have the facility name, the facility number, which is the number that the federal government assigns to it, the ownership type, the affiliated entity name, if it's part of an affiliated entity, whether there's an abuse icon, special focus facility, as I just mentioned, the inspection, more than 2 years, whether the provider has changed ownership, their ratings, which we talked about early now, their expected staffing. That's a new calculation that we started doing when we did this report in January. So you can see the expected staffing levels for your facility or facilities in your community based upon the reported needs of the residents, their ratings, their citations for substandard care and any fines that they've had, and substantiated complaints. So all that information, again, is available and pretty easily searchable. I know it looks like a lot of information, but we try to put it in a way that it's as useful as possible for people to select the communities, the town, the county, and then search for specific facilities, et cetera. That's the end of our data, the data portion of our program. What I'm going to want to talk about now is sufficient care to avoid pressure ulcers. A little bit of background, which I often include if you're familiar with our programs, just to kind of lay the groundwork for, how do residents' rights exist in the nursing homes in our community, in our state, and in our country. They're due to the nursing reform law, which passed, in 1987. It was implemented in 1991, which means that that's when the regulations came out. And the reason why I mention that is because these rules, there's been some modifications over the years, but pretty much these rules have been in place for decades. So there's really nothing new here. And what the reform law requires is that every resident receive the individualized care and the services that they need to attain and maintain their highest practicable physical, emotional, and psychosocial well-being. I know that's kind of a mouthful. It's highest practicable, not highest practical. And the difference there is practicable means based upon the individual. The nursing home reform law is really focused on the resident and recognizing that they're a human being and that we're entrusting that human beings' care to a nursing home. Highest practicable means what they are able to achieve, attain, and maintain with with services. Excuse me. So one example that I think of often is that if I go to a nursing home and I could go to the bathroom with some assistance, excuse me, the nursing home is required to provide that assistance and should not be putting me into a diaper because there's not enough staff. And before I move on, I know people get frustrated by this, and I do too. I have family members right now who are in nursing homes, and I know that can be very challenging to achieve, and facilities claim that they're short-staffed, etc. But that is what the rule requires. That is what nursing homes are paid to provide. Again, I know that it's really challenging. That's why our organization exists. That's why the long-term care ombudsman exists. That's why the New York State Department of Health exists, is that we are trying to overcome these challenges. And one way to do that is for residents and families and legislators and ombudsmen to be informed about what residents' rights are. So we know, if we know what residents' rights are, then we can fight to, or advocate for them to be achieved. If we don't know what they are, then it's very hard to get them achieved. So I want to talk a little bit about pressure ulcers. I know people have, very different understandings. I am not a clinician. I'm not a doctor or a clinical practitioner of any kind. I am an attorney and, of course, a researcher and a policy advocate. So what I do when we are dealing with issues such as clinical issues like pressure ulcers is I look for other expertise. And this is, what I have here is based upon expertise, as I had one citation here, excuse me, that you can see at the bottom. So pressure ulcers, sometimes they're called pressure sores or bed sores or pressure injuries. They're essentially an underlying damage to the skin. Usually they start off as a red spot, but then if they're not treated appropriately, they can continue to fester and they could develop into a really serious wound. And unfortunately, we know that too often nursing home residents can get very, very serious pressure ulcers, a degradation of the skin and of muscle mass, etc., that can be really, unfortunately, quite horrible and dangerous and life-threatening. So what I wanted to note here and focus on for a moment are the second two bullets. Again, I'm not personally a clinician, so I look for, where is the expertise? The Centers for Disease and Control and Prevention, the CDC, says, and I quote here, it's in bold, pressure ulcers, also known as bed sores, are serious medical conditions and one of the most important measures of the quality of clinical care in nursing homes. And then the third bullet notes that while some pressure ulcers are unavoidable, research indicates, again, this comes, and I cite the research here at the bottom, in the vast majority of cases, appropriate identification and mitigation of risk factors can prevent or minimize pressure ulcer formation. Unfortunately, we see far, far too many pressure ulcers in nursing homes. This has actually been a particularly significant issue for New York nursing homes. We tend to have higher overall pressure ulcer rates than the national average. And this is despite the fact that the state has for many, many years tried to so-called incentivize nursing homes to provide better pressure ulcer care. But irrespective of that, nursing homes are required to provide appropriate care and services. I'm going to talk about that next. So this comes from the law. This is the Code of Federal Regulations. That's what 42 CFR Section 483.25B1 stands for skin integrity. Based on the comprehensive assessment of a resident, the facility must ensure, must, not can, not if it feels like it, not if it has enough money. The facility must ensure, one, that a resident receives care consistent with professional standards of practice, excuse me, to prevent pressure ulcers and does not develop pressure ulcers unless the individual's clinical condition demonstrates that they were unavoidable. Like, oh, to me, almost every word in that sentence is so important. And that a resident with pressure ulcers receives the necessary treatment and services consistent with professional standards of practice to promote healing, prevent infection, and prevent new ulcers from developing. And I note here, what does unavoidable mean? Again, just looking at the first bullet, that the resident has to receive care to prevent pressure ulcers and that they don't develop pressure ulcers unless the individual's clinical condition demonstrates that they were unavoidable. What does that mean? According to CMS, the Federal Centers for Medicare and Medicaid Services, unavoidable means that a pressure ulcer formed even though the facility had evaluated the resident's clinical condition, and risk factors, defined and implemented interventions consistent with the resident's needs, goals, and professional standards of practice, and monitored and evaluated the impact of those interventions and revised their approaches as appropriate. So this is really, very, very, very strong language. And the fact that we have pretty high pressure ulcer rates in our nursing homes is obviously very upsetting and very concerning. It's concerning for the resident and upsetting for the resident and for their family. Those pressure ulcers can be terrible. And I know when my brother-in-law was in a nursing home several years ago, he had the early stages of a pressure ulcer just in his short time of being there. Because if someone is vulnerable, they can happen fast. But again, that's why people are going to a nursing home, because nursing homes, by definition, are supposed to be providing, are required to be providing 24-hour-a-day skilled nursing services. So a little bit about how pressure ulcers can be prevented and treated. Federal guidance states that, and this is a quote, effective prevention and treatment are based upon consistently providing routine and individualized interventions, including redistributing pressure, such as repositioning, protecting, offloading heals, minimizing the resident's exposure to moisture, keeping their skin clean, providing support and non-irritating services, maintaining or improving the resident's nutrition and hydration status, because that could be a huge issue too if a resident is getting the appropriate nutrition and hydration. So getting a little bit back to the data, and again, I just wanted to provide an overview, and I'll talk about some of the resources we have that you can use and share in a moment. But this is where you can find the pressure ulcer rates for your nursing home and those in your community. And you can see it kind of follows the pattern of how we provide data. This is just a snapshot, and this will be on our on the page with today's presentation in a couple of days, but as a Excel file, excuse me. But you can see the name of the nursing home here. I'll try to make it a little bigger. Their city and their county. So again, if you have, if you're an ombudsman, if you are a state legislator, you can look at what's going on in the counties in your area or jurisdiction. You could look at what's going on specifically in the cities. This is the latest report information for the last quarter of 2024. And this is the information percentages. The way that it's reported, and I wanted to keep that here, is that for each facility, you'll see they're reported twice. So let's look at Emerald Peak Rehab and Nursing. They'll report a no and a yes. Unhealed pressure ulcers is the question, no and yes. So you see that for every facility. Unfortunately, as you see here, some of them don't have data, and that's troubling. Some of them do. So that is obviously not helpful. This again comes directly from the federal file. I did double check it. So those data just are not there for whatever reason. Some facilities, as I mentioned earlier on, may have their data suppressed because they are a problem facility, or there was an issue with the integrity of the data that they reported. But you can see again, so these are like generally higher numbers are no. but you can very easily no and yes for this facility. So this is St. John's Healthcare Corporation in Rochester. No 87, yes 12.73, which is really, really high. Again, think about it. These are almost always avoidable with appropriate care and monitoring. And so to see some of these numbers is obviously very concerning. We also post on our website citations for pressure ulcers and other citations as well. So you can look up the citation and the citations for your nursing home, and you can select by the deficiency number. Let me just go quickly up because I forgot to mention it before. Oh, there we go. So here under the law, this is, and you'll see this is in our comes from our fact sheet, which is available on our website. Excuse me. We always include the F tag. Here it's F686. That's the F tag. F tag means it's what the state surveyors use to code the citation. So F686, to get back down to what we were talking about, is deficient practice regarding pressure ulcer care, avoiding pressure ulcers and or treating pressure ulcers appropriately. So that's 686. So you can see when your facility has been cited for a specific deficiency. We have the F-tag numbers, and we also have the, as you can see here, in the description of what the deficiency was. And then I just note here in the box some things that, if your facility is cited for something, whether it be pressure ulcers or anything else, you can talk. This is an issue for families, an issue for residents, issue for ombudsmen, issue for state legislators. What is the facility doing? Are they addressing the problem in a consistent manner, facility-wide, day, nights, and weekends? Those are just a couple of really important things to be considering. And these are, I think, especially useful for a resident or family council when they have an issue, whether pressure ulcers, as we're talking about here, whether they see a citation or it's another citation. Now, just as a quick aside, every nursing home is required to post their latest statement of deficiencies, it's called, their latest report from their last inspection, as well as their plan of correction, what they're going to do to address the issues. The way that that's addressed should be, as I note here, consistent, facility-wide, and encompassing every single day, not just Monday through Friday, not just the daytime schedule, et cetera. That it's always the facilities are always addressing any deficiencies that are found. So this is, I think, helpful information for people. So again, just to quickly recap, here we have the pressure ulcer rates for your facility or facilities in your community that can be found by the county, by the city, or by the specific provider name. And then the same thing with the citations. Unfortunately, they only have city or town here. They don't have county for these data. So we have the state, obviously. We have city, town, so you can see what city or town it's in, and then you can look up by provider name. Another way to find this information is if you go to Medicare.gov Care Compare, they have the pressure ulcer rates in their facility listings. This is something that I recommend when I have a family member that's going to a nursing home to use Care Compare. It's a good way to find. It includes some of the ratings we started off talking about today, the overall rating I'm circling here, which is broken down to health inspection rating, staffing rating, and the so-called quality measures. And if you click on this button, you'll get to the next page, and you can see the long-stay quality measures include, where I have the arrow, the percent of long-stay residents with pressure ulcers. So you can get it, and you can compare it pretty easily through our database. But if you're looking at a specific facility on Care Compare, you can also get it that way. And then I just wanted to quickly show you, these are some of the resources that we have. So this is the fact sheet, which includes a lot of the information that I was just talking about. Virtually all of our fact sheets are 2 pages. You can see both pages here. They're, so people can print them out and can share them with resident councils, family councils, with the nursing homes themselves. Quite often we'll tell people, if a nursing home is not aware of or says they're not aware of a resident right, that you can use these fact sheets to show the facility, well, this is my right. How can you help me achieve it? That's a good way to get started when advocating for a resident as a family member, as a resident, and as a family or resident council. But this is our fact sheet, again, available on our website, along with our other fact sheets. This is a quick handout that we put together. We don't do this for every issue, but pressure ulcers are obviously an important issue that affect far too many people. So we just did a quick handout. We distributed a lot of them in hard copy years ago. Now you're free to, of course, print them out and share as you are with any of these materials. And then again, because pressure ulcers are such a significant issue, we have a longer issue alert. I just showed the first couple of pages, but I think it's a 4-page issue alert to give you a little bit more information. And then lastly, we have our webinar. We did a webinar a couple of years ago on pressure ulcers and infection control. And so that is available on our website at the link that shows there, and it gets into some specific details as well. I want to just quickly talk about a few other resources that I thought were relevant here. This is our resident assessment and care planning. As we said at the very start of this program, nursing homes are required to provide care that is centered on the resident and that aligns with their needs and their goals and their desires. That includes here, so if you take a look, all of these issues, I'm going to try to make it bigger. The assessment must include at least the following: identification, demographic information, customary routine, cognitive patterns, communication and vision abilities, mood and behavioral patterns. But here you can see skin condition is one of them. So that's important. This could be a useful resource for you in your education and advocacy efforts. And then the second page, again, this is a 2-page fact sheet, is a comprehensive person-centered care planning that, based upon the resident assessment, the facility must develop and implement a comprehensive person-centered care plan that is consistent with all the resident rights we talked about, as well as having measurable objectives and timeframes. Again, I don't want people to think that I don't understand how challenging these things can be. And that's why we do this, to try to provide people with actionable information and resources that they could use to see what's going on and to advocate for something better, and to share that information with their families, with other residents, with resident family councils, and legislators can certainly, we can share that with them, and they could also share that when people call them for information. And then this is just a copy of our record keeping form. We have a lot of different resources on our website. This is, I think, is one of our more useful ones, I should say. It's just the first page of the form, but it provides information about, it provides a means of tracking when you have an issue. So if you do see an issue, for instance, I remember when I saw my brother-in-law was developing red spots, I alerted the nurse as to what was going on, but it's very hard to keep track of everything. I mean, we're not, we all have lives besides keeping track of specific issues. So we wanted to put together a form that could be easily used. So this form, and essentially just, largely repeats this page, I'm trying to make it bigger, is that this is, we have a date on it over here, what the problem was, who was involved. Like, for instance, I could list the nurses they were changing my brother-in-law when I saw the spot on his leg, who I spoke to, what they said they were going to do, and what actions were actually taken. And then, if so, you have a record showing what's going on. And the reason why we did this, just very quickly, I know I want to leave time for Q&A, is that I know for people it's really hard. I remember when I was putting together these fact sheets with 2 wonderful family councils in New York City over a 1.5 year period, they allowed me to come in, and is that a lot of times people would come up to me after a program and say, I've been dealing with this issue with my mother for months. And they say they're going to do something and they make a change and then it happens again. And I was like, well, that is a very legitimate concern. However, if you don't have like concrete information, it makes it very hard for it to be actionable if you were to take that, say, to the State Department of Health, or even before that, taking that to the administrator, et cetera. So if you're able to put a date, you're able to put what was supposed to happen and who you spoke to, which is really what this does here, then you have a record that you can refer back to pretty easily. So that's just one of our resources. This is just a sample family council meeting agenda. We have that for both resident councils and family councils to support their work. And this is our fact sheet on filing a grievance. Every nursing home now is required to have a grievance officer who handles complaints about care or services and make sure that they're investigated and that there is some resolution. So it's a very powerful rule. It just came into effect a few years ago. I'm hearing reports that nursing homes are not doing a great job on this, but I think we need to use it more, and I think we may need to do more advocacy to make sure that nursing homes are doing a good job. But it has a strong potential, I should say. Nothing is perfect, but it has a strong potential of helping us to more effectively address issues within the nursing home. And then, if you're not able to address issues in the nursing home, we have on our website an abuse, neglect, and crime reporting center. And this gives you information as well as links to federal contacts for filing a complaint, to state agency contacts, to the Medicaid Fraud Control Unit. That's part of the Attorney General's office here in New York. They have an excellent, excellent team, and they take complaints about resident abuse and neglect, forms for reporting suspicion of a crime against a nursing home resident, etc. Again, this will be on our website, and a lot of this information, of course, is itself standalone pages on our website for you to use. Thank you, everyone, for joining us today. I'm going to leave some time, I think I did, for Q&A. We have about 5 minutes. We could stay a little bit longer. Our next program will be June 12th, again at 11 a.m. We'll do another data update, and then the focus of the residents' rights will be on transfer and discharge rights. And here you can see some information. If you'd like to suggest a topic for a future program, please email info@ltccc.org, or if you'd like to join our listserv community, please again email info@ltccc.org. You could visit us on the web, Facebook, Twitter, Instagram. We're now on, I think, Blue Sky as well. But I didn't put it in here. And thank you to the Dyson Foundation and to the Field Hall Foundation for supporting this work. And with that, I'm going to stop sharing and we can answer a few questions.
Do you have any questions? You can just feel free to either come off mute or raise your virtual hand.
Well, I see, and Diane Gurdon had a question. Thanks, Diana, for joining us today. Any advice for constituents who are having challenges getting appropriate level of care written in the care plan? They tried the ombudsman, but that did not help. Well, I think, thanks, Diane. I mean, I think this is a really significant issue. So we have the fact sheet, which could be useful for them to even present to the facility staff, to present to the nurse, or present to the administrator. I always suggest starting. I don't want to say starting at the bottom, but starting at the level closest to the resident and moving out from there. So you can start. You can start with the nurses who are providing care. Say that they want to have a care plan. If they're not getting a good assessment and care plan, then move up from there to the director of nursing. Perhaps speak to social work staff, et cetera. But having the fact sheet can be helpful because it shows that this is what their rights are. And the language is very clear that, as I was quoting before, that it shows the minimum of what should be included. And we also actually have excuse me, we have one of the tools that I mentioned, one of the forms is to prepare people for their assessment and care planning so that they can note some of the issues that are important to them coming into it. that's not to be honest, a great answer. I mean, this is an issue that we've had, which is why, we're talking about and develop some of these materials, is that facilities too often are very, very quick and do not provide a really good assessment and care plan. There have been some strengthening of the rules around that over the years during the President Obama's administration. They strengthened some of the rules around that. And I think, of course, it comes down to enforcement. But at the start, I would say, again, working with residents and their families is helping them understand what their rights are and having the tools to advocate for those rights. And, I think that plugging in with the legislators and having legislative offices such as yours that are responsive really makes a difference and can move to change that. Let me see. Susan Lesser asked, is a memory care unit that is designated as part of an AL? So I just want to be clear, we're only talking about nursing homes here. We're not talking about assisted living at all. Assisted living, unfortunately, does not have, there's very, very, very few rules when it comes to clinical care. Thank you, Margaret. I agree. Would love to see this program rules and regulations in assisted living and see staffing and other issues. They are far less regulated than nursing homes. And unfortunately, all the data that we presented, we cannot do that for assisted living because we just don't have the accessible information. There's another, I'm sorry, Susan, another AL question. Another AL question. We'll try to do something on assisted living. We do try to integrate that into some of our monthly webinars that we do on occasion. But again, because the rules aren't there and because the data are not there, it's much more difficult. It's kind of like the Wild West. And I think we had if you check out our latest senior care policy brief, which just came out a few days ago, we talk about some of these issues in assisted living and how Senator Gillibrand, I think, was one of the senators who wrote a letter to the Government Accountability Office asking them to do a new study on assisted living, because a lot of those are a lot of those are caring for people with high levels of needs, and they're not providing the appropriate care and services. Some are very good, but some aren't. And we just don't know because we don't have access to good information about who's even providing care the way we do in a nursing home. So thank you all.
Sorry, Richard.
Yes.
Just quickly, that actually is coming out in the April 15th
Thank
policy
you.
brief. So it'll be out in just a few days. You can check it out then.
Yeah. So actually, that's great. Thank you, Hallie. And so my mistake that the newsletter that I mentioned is the Senior Care Policy Brief. It's only a one-pager, always a one-pager. We keep it very brief. That'll be coming out on the 15th. Please do visit our website for it. Please do sign up for to get that. We never sell anyone's name. We don't, bug people for donations and stuff very often. And it's really just to provide information. But I'll say thank you, everyone, for joining us today. The recording will be up, and please feel free to share it.